Welcome, and thank you for joining us today for a conversation about UPMC Children's Hospital of Pittsburgh's Rehabilitation Institute as part of our virtual learning series, Raising the Bar. I'm Rachel Petroselli, and I'm president of Children's Hospital of Pittsburgh Foundation, and I'm delighted today to be joined by Colby Kaufman. Colby is going to assist in moderating today's discussion. She is a passionate advocate and supporter of UPMC Children's, and also in recruiting for Dick's Sporting Goods. We each wear a lot of hats, Colby, and I think, though, today's discussion will benefit most from our perspective as moms of kids who have needed the services at UPMC Children's Hospital of Pittsburgh's Rehabilitation Institute. For our journey, my family was excited to welcome a little baby girl 20 years ago. And at first we thought she was really healthy. And you know, her name is Hannah. And we thought everything was fine. But within a few months, we could see that she was missing her developmental milestones. And we worried that she wouldn't walk, she wouldn't talk, and she wouldn't be able to do the things that her peers are doing. But fortunately, UPMC Children's was there, and through a lot of outpatient support and services of physical rehabilitation, or physical therapy, occupational therapy, and speech therapy, she's achieved her milestones, and she's going to celebrate her 20th birthday next month. Our story is just one of many, I'm sure, that can point to the impact that the expertise and services of UPMC Children's has in helping to make a difference for children that have lost function or have lost their ability to communicate or their ability to move. And rehabilitation medicine is a part of helping them regain that function. But before we get too far into our program, I do have a couple of reminders to share. And that is, first, we have time at the end of our program to answer questions. So we ask that you please submit them using the chat function. And we are recording today's session, so I will be sure to send you an email in the days that follow, and we ask that you send that link to others that you think might find this of interest. And now we can get into our program, and I'm going to turn things over to Colby, because Colby, you too have had an experience at Children's, specifically with rehabilitation medicine, and I'd love for you to share with our audience today what your journey was like.
Yeah, of course, Rachel. And I just want to start off by thanking you from the bottom of my heart and all of the Children's Foundation for allowing us to share Nora's story. I often share with you and the entire team that as much as I hope our journey and our story help others, it's also very healing for us as well. So thank you. Our daughter Nora was like any other healthy child. She was meeting every milestone. And if I could boast a little bit about Nora, I think she was exceeding her milestones. She had this way about her. She was calm, she was funny, she was sweet, a little feisty at times. She just had this presence. When you were in a room with Nora, you felt it. It was undeniable. We often refer to it as Nora's light. And that's what we love to come here and share is her light. It wasn't until after we celebrated her second birthday that we started noticing symptoms that something was a little off. It started out that she was getting nauseous at school. She was beginning to get nauseous at home. We noticed that she wanted to sleep more frequently and longer. So we contacted her pediatrician because we knew something wasn't quite right. We did put Nora on an anti-nausea medicine temporarily until we could figure out what exactly was going on. It was when she started to lose her balance. She needed to hold on to a wall in order to be able to walk. I just, as a mother, and my husband had the same feeling, we knew in the pit of our stomach something was seriously wrong. So we contacted our pediatrician and we got her a brain MRI scheduled at the Children's Hospital of Pittsburgh immediately. We went in on August 4th of 2017, had a brain MRI scheduled. We were told that the scan would take about 2 hours. 4 hours later, a nurse came out, told us that they decided to do some more imaging. brought us back to a very small room filled with a lot of physicians, radiologists, and we were read the results of a scan that showed they had found evidence of tumor in Nora's brain that had spread to her spine. We were told that Nora would need surgery immediately. We were transferred directly to the PICU. We awaited her surgery that took place on August 8th. We knew that with this procedure, there were a lot of risks, not only with the surgery itself, but some of the side effects that Nora would suffer because of the surgery. Even more importantly, knowing the treatment plan that we had ahead, Nora would go on to receive chemotherapy, high-dose chemotherapy, proton radiation, intrathecal radiation. We knew that these would also come with side effects as well. So all of this news is getting delivered to us, and I often say it's like one day I was watching Nora run through the sprinklers in the backyard on her second birthday, and the next we're living in a hospital. Our worlds were completely flipped upside down, and we knew before we could even consider any sort of treatment, any sort of chemotherapy, radiation, we needed to get Nora to rehab, and that's how we were introduced to the Children's Hospital Rehab Unit. We wanted her to get stronger. We wanted her to get back to as close to baseline as we possibly could, so that she could withstand these treatments. So we were transferred to the rehab unit, and it's a different world here. It's a lot of beautiful children that have been handed extremely unfair circumstances. We've come across so many beautiful families and their children's, and when I think back, you know, there were individuals who were suffering from seizures. There was a teenage boy who was paralyzed from a diving accident. There were car accidents. There were children born with disabilities. In our case, we were there because of cancer. So all different journeys, all different baselines, all different realistic expectations that we had of the goals that we could reach with our child. For us, Nora lost the ability to talk from the surgery and from her diagnosis. She lost her ability to walk. Her hand-eye coordination was severely altered. Her vision was slightly impaired. Her left eye now tilted inward. So we had to start patching to really start strengthening the eye back out so she was able to see again. All the things that just came natural to Nora prior to her diagnosis, prior to this brain surgery, were lost, and she had to relearn all of these. So we found ourselves at the rehab unit for speech therapy, for physical therapy, for occupational therapy. And I know one of the biggest goals for my husband and I was to get Nora strong enough. So one of the biggest things that she lost was her ability to walk. We wanted her to be strong enough to walk with little assistance, and I look back at videos on my phone. There was a physical therapist, Julie, who holds a very special place in our heart, and you'll see in the video that, you know, both Jordan, my husband, and Julie are holding Nora, and she could barely stand up on her own. And then the next video, you see just Julie holding Nora, and she's walking slowly but surely. And then, you know, when I scroll to a couple days later and I see the next video, it's just Julie holding Nora's hands, and to watch the progression of your child start to meet those baselines and start to meet those, you know, the goals that you were so fearful that she may never reach again. It's one of the most beautiful things as a parent that you can watch unfold before your eyes. And these are the types of stories that are happening at the rehab unit. This is what's happening there and why it's so important to us. And I just think of all the incredible individuals that we've come across, all the therapists, and all that they've done for us, you know, at the time that we were there. And as a mom, I can't help but wonder what more we could offer. I think about the doors that it would open by bringing this rehab unit in-house to the Children's Hospital of Pittsburgh and not have it up the street. I do truly feel from the bottom of my heart that these therapists would not be limited. They would have doors open for them, and they would be able to do so much with all of the wonderful amenities that are offered at the Children's Hospital by bringing it on site.
Thank you,
Yeah, of course.
sharing your experience. And Nora's light always shines bright in you. When you talk about her, and seeing those videos, I mean, the dramatic progression you could see in just a matter of a couple of weeks, I can't imagine how that must have felt. You had touched on the fact that the Rehab Institute isn't located in that big, beautiful UPMC Children's Hospital that is not that old. It's only 12 years old. And so it's down the street, located within the Children's Home of Pittsburgh.
Yeah.
What was it like? What was it like to be able to see the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines and to watch the progression of your child start to meet those baselines That must have been a difficult experience to feel a little isolated from what was happening at the main hospital. I'm sure there were challenges, but also maybe a feeling of a cocoon of support and services that were located there. This might be a good time for us to talk with Dr. Amy Houtro, who's our Chief of Rehabilitative Medicine. And Dr. Houtro is here with us today via Zoom. And I'd love for Dr. Houtro to talk to us about the expansive services that we have in rehabilitation medicine and why that Rehab Institute, the Rehab Inpatient Unit, is down the street. Because clearly with the two experiences that Colby and I've touched on, we know that there's lots of outpatient services and inpatient services. So Dr. Houtro, can you share more about your division and the program at Children's?
Yes, thank you, Rachel. I'm really delighted to be here with you and Colby. My name is Amy Houtro, and I am the Chief of Pediatric Rehabilitation Medicine here at UPMC Children's Hospital, Pittsburgh. I'm also an educator, helping educate the next generation of clinicians who will care for children with disabilities, and I'm a researcher, studying access to healthcare for children with disabilities and how their families interact with the healthcare system. I've dedicated my career to optimizing the health, function, and well-being of children with disabilities, as has our entire team. Here at UPMC Children's Hospital of Pittsburgh Rehabilitation Unit, we have a lot of clinicians. This graphic shows you some of our activities in rehabilitation medicine, physical therapy, occupational therapy, speech therapy and audiology, and then our special programs, the Center for Independence, the Feeding and Swallowing Program, and as you mentioned, our Children's Hospital Rehabilitation Unit. That is a program that provides coordinated, comprehensive, intense rehabilitation services to children after serious injury, illness, or surgery who need much more intense services and daily supervision by a team leader that's a physician, a rehabilitation medicine doctor, as well as 24-hour around-the-clock nursing care. And as you heard in Colby's discussion, that integration of all of the therapy services. So I was brought here about 9 years ago after the Children's Hospital had opened, as you mentioned, 12 years ago, and there was no inpatient rehabilitation program at that time. And we are a very busy children's hospital, which meant that we needed to lease space in another facility, the Children's Home, which is about 0.8 of a mile away. And we have a children's hospital unit right in that building. We're down the street, but it is Children's Hospital. And that team is incredibly dedicated. I would like to show you a video, and so you can hear it from them. You can hear their compassion, their desire to serve, their dedication, their innovation down at the CHRU as they provide intense, coordinated, and comprehensive services to children after serious injury, illness, or surgery.
Rehab is a very broad definition. Our goal is to optimize the function and quality of life for every child. That can certainly be in the hospital. So a lot of folks who are hospitalized, especially after a trauma, especially after a long illness, their child may not be able to do the things they did the way they did before. And so our goal is to help try to see if we can push that child as close to their baseline and past that.
So the kids we care for have endured big illnesses or big injuries, and they need somewhere else to go to practice all of those skills in order to be able to go home to their houses and their communities. So we really strive to regain strength and independence during their time here.
So we see all sorts of patients, everyone from people who have had neurologic injuries, so brain injuries, spinal cord injuries, strokes, anything along those lines. We've seen patients who have had transplants. We've seen patients with cancer. We've seen, the whole gamut of kiddos. In rehab, you're gonna get up and you're gonna get dressed and we're gonna get you out of bed and you're gonna help with all of those things, and then you're gonna take yourself down to the gym and we will do, whatever your goals are. So we're working on standing, or we're working on sitting balance, or working on vision. We're working on getting ready for the day. We're really focusing on independence and focusing on, recovery and kind of getting back to doing the things that they were doing before they came to rehab.
For some of those folks, that means coming to our inpatient rehab unit. For a lot of those families, thankfully means leaving the hospital and going to an outpatient therapy center. On the medical side, we're going to be working very closely with the other medical services, the therapy services, to kind of wrap ourselves around the family and the patient to see what can we do to help optimize the function, the health, and well-being, quality of life of every patient, every family that we serve.
I think for every patient that I care for and every family that we're connected with, is that they would feel like they were the only patient that we had on our caseload at the time, that they would feel cared for and encouraged and loved, but they would feel that they knew that they were getting the best care that they could get. They knew that it was research-based, that it was evidence-based, that everything that we did was for a good reason, and that everything that we recommended to them was also for a good reason. And that reason is to maximize their function so that their little one can do everything that they possibly can do. I absolutely love the fact that I get to work with patients from all over the world. Patients that don't speak my language, patients that don't have our culture or understand, they have different values, different roles, different things that they're striving for. And I love working with all of them. So even that day-to-day patient that just comes in and walks in and says, I'm only here, I might be with them for an hour. I love that patient just as much as, the patient that I've seen for 4 years.
It's funny because it's little moments. It's things like we've been trying all week to open a water bottle container and we couldn't, and then finally we did it. Or it's a patient who has been working their entire 6 weeks on figuring out how they're gonna put their pants on again. And finally one day it clicks and they just do it, and it's magic. One of my favorite things, and it's a story of a family who their daughter was at rehab. I believe she was 4 years old.
It was her first day here, new people, scared, terrified, really hadn't laughed in a while. Like, she wasn't really speaking much of the time.
So you walk in with your goofy smile and your silly self, and I have this monkey toy, and it's a monkey head, and you put the bananas in the monkey's mouth, and that's apparently, it's a fun little game. And she thought that monkey was the funniest thing she had ever seen in her whole life. And for the very first time, and in a while anyway, she laughed. And her family mentioned that was something that was very special to them. And, little things like that, it's pretty cool.
Caitlin had done her homework. She knew what this young lady liked, what she was passionate about, what's going to motivate her, and had her laughing within a few minutes. And so once again, the parents at tremendous ease that helped them feel confident. This is someone who knows what they're doing. For adults, you can tell us this is what you need to do to get better, and hopefully, we have the awareness and the insight that, all right, this is what I have to do. I have to do it. You can't really do that with a 3-year-old or a 5-year-old. You don't have to trick them into it, but you have to make it into play so that they're doing what they need to do to get better, but they still have to have fun doing it. Otherwise, it's not going to particularly go very well. We celebrate the small wins because we know that recovery from something that brought you here to CHRU is not going to happen within a day or so. Oftentimes it takes weeks, sometimes longer. And so these small wins we celebrate with great joy. I'm biased, but I think we have an amazing team, the best team. Our patients' family satisfaction score has been the 99th percentile for a couple of years now. There's a sense of purpose that we all have, and I think part of that is providing the best care to the families we serve. Families can feel that energy. Families can feel that level of passion of multiple folks who are going above and beyond to make sure that the family's needs are met, that the child's needs are met, and I think that is why our scores have been the 99th percentile.
All I want to do is, at the end of the day, know that my life was used for service to others and to improve their quality of life, improve their life, and in turn to improve the family's life too.
I'm able to use the science side of my brain to come up with solutions for kids, but I get to use my heart to get to know a family and to get to know what matters to them, to be able to work those two parts together to achieve a common goal.
Kids are so resilient. They come in smiling and they leave with even a bigger smile. They just are here ready to work hard.
We're fortunate enough that we have multiple sites throughout the Pittsburgh area, but despite that, we still can't meet the needs of kind of all of Western Pennsylvania. You know, we have satellites in Wexford, Monroeville, and in the south in Bridgeville. But you know, our kids don't just live in the surrounding Pittsburgh area. We take care of kids in all of Western Pennsylvania. And so, you know, when kids leave here at rehab, when kids leave here at the hospital and have outpatient therapy needs, sometimes it can be very challenging to find outpatient therapy locations that have pediatric services. We wish all of our kids could go to Wexford or Bridgeville or here, but a lot of them can't. We have 8 beds. We're having to delay kids coming to rehab, or unfortunately picking and choosing those who have the highest needs and trying to figure out solutions for those kids who have like moderate needs. So that's an ongoing concern. Just regionally, there are some kids that we just aren't able to meet the needs of. So some kids and young adults with chronic pain who have significant functional issues that maybe not be able to be met in the outpatient arena. We don't have an inpatient pain program. And so some of these kids and families are having to go outside of the region, going to Cleveland, going to Cincinnati, elsewhere, to get that level of support. We have the teams and the pieces to build that. We don't have the bed space. The space we're at, we're thankful for it. We're thankful that we're able to bring this level of service to the kids in our community. But this space was not designed to be an inpatient rehab unit. Our gym space is quite small. The therapists are forced to treat in the hallways much of the time, if not most of the time. You know, we have kids with different abilities, different ages, so we need equipment of lots of different sizes. We don't have enough storage for really that equipment, so we're kind of keeping that in different places. It's in treatment areas, so space is a challenge. Being down the street is certainly a stressor as well. We feel like, you know, if our rehab unit is in the hospital, we can certainly deliver inpatient rehab services to kids earlier in their acute care course, which I would hope that would lead to, you know, potentially shorter rehab stays and hopefully less, you know, deconditioning. Just being in the hospital, being sick. You know, our acute care therapists are fantastic, but they're covering the whole hospital. They can't see the patients with this intensity of therapy service. They're not going to be able to get kids, you know, get everyone 3 hours of therapy a day. So if we were able to get kids to our inpatient rehab unit sooner, we could hopefully prevent some of the deconditioning, some of the functional decline that they have just being in the hospital, being relatively immobile. The dream for me would be to optimize their function, their medical well-being, and if not as important, more important, their emotional and social well-being. We know that emotional and social health are so linked to overall well-being. Unfortunately, when you have a medical condition, you have functional limitations or functional deficits, we know that emotional and social health can be affected. Philanthropy has made such a huge impact in the patients and families we serve. Unfortunately, life doesn't stop when families are here in the hospital. You know, there's still bills to be paid. It can be challenging for parents to work while a child is in the hospital and while a child is here at rehab. Not all the equipment that we think is helpful for a child always gets covered by insurance, or even if it is, there might be a significant delay of when they leave rehab, or even if they're an outpatient, of when that equipment might become available. Most of our families aren't from the Pittsburgh area. They're from Western Pennsylvania, some of them an hour, 2 hours, 3 hours away. So getting just back and forth to the rehab unit, to the hospital, is cost prohibitive. So philanthropy has been huge to allow those families to be here to help support their child during their time of need. It's also been instrumental in helping kids get the equipment they need to optimize their health. We're able to be in the 90th percentile. We're able to celebrate these wins with the space we currently have. You know, imagine what we could do if we had the best space.
I love seeing that video, and it truthfully does hit home for us and for my family. So I think about all the incredible things that they are capable of doing in the space that they have, like Amit stated, but I imagine what more the team would be able to do if they had the space. And Amy, I would love, in your own words, for you to tell us why rehab medicine is so important to you and to all of us.
Well, thank you. That's just a really important question, because like you, it is really very personal for me. So I was born with an exceptionally rare genetic disorder. So as a child, I needed a lot of coordinated and highly specialized medical care. When I was 4 years old, I had a surgery that required me to lay down for 6 months. No walking. I wasn't even allowed to sit up while my body healed. So I know firsthand the value of rehabilitation. And by that age, I already knew that I wanted to be a doctor who took care of kids like me, kids with disabilities. The goal of what we do in pediatric rehabilitation medicine and our whole team is to help children with temporary or permanent disabilities live their lives to the fullest, help them participate in life as they desire, to play, to learn, to thrive. And we collaborate with other physicians and therapists to help children. This model of team-based care is shown to be highly effective. And of course, families appreciate our goal-based, collaborative approach to family-centered care that looks at the whole child in the context of their families and sees them for more than just their health problem, whether it's a brain tumor or a bone disorder. So this is why rehabilitation is so important to all of us.
And Amy, can you tell us a little bit about what brought you to the Children's Hospital of UPMC?
Sure. The short answer is easy: opportunity. We're really incredibly lucky here in Pittsburgh to have this amazing children's hospital that provides quaternary care for all sorts of really complicated and rare health conditions. And the University of Pittsburgh has a world-renowned physical medicine and rehabilitation department. So I was recruited to help build our pediatric rehabilitation medicine program. Children who have disabilities, children who have serious illness, injuries, or surgeries benefit and deserve coordinated and interdisciplinary rehabilitation. And that foundation was already here at UPMC Children's with awesome, dedicated providers who share that vision. So how could I say no to helping grow our services?
So you truly did come to Children's with the intent of building a world-class program, and I definitely believe that's what you're doing and that's what you've done. And it sounds to me like the team has accomplished so much already, but I can't help but wonder what you feel is missing. Like, where could we be better? What could we do better?
When I think about this, I think about children being in the center of everything we plan. So that's how I approach this and our goal, so that all children with disabilities, regardless of their circumstances, can live full lives, participating in the world as they desire, grow up to be adults with autonomy and independence. We want them to thrive and have full lives. And we know that more children in the region need our services. You heard that in the video. So we need to grow. We need to expand our services in communities. And really, we want to be a model for providing care where children are, such as in schools. And we also need to help develop avenues to reach children from under-resourced situations. We know that there are children that need our services that can't really access them. But we need to expand right here on campus. I mean, as you experienced and as you heard in the video, I'll use our rehabilitation unit as a perfect example. So it is a part of the Children's Hospital, but located not in our main building. And there are definitely positives to that setup, but it's also a challenge. If we were here in the main campus in this building, we could transition children to rehabilitation earlier. We could integrate our services more seamlessly with other medical care happening for children. And that means children could go home earlier. This is a real goal that we have. We want to get those kids home and back to their lives. We also want to be an innovative model for the rest of the country. And aren't we lucky that we have such an amazing intensive care program here with great researchers in the PICU, such as Erica Fink, who study early rehabilitation with me and work very closely to help provide care for the whole child across the continuum. So we want to set the stage for advancement. We want to create an integrated program where kids can get critical care services they need and rehabilitation services simultaneously. And then we have a whole host of other services that we're engaged with, such as the Heart Center and obviously the neuro-oncology program that you talked about. We also work with anesthesiology. One of our doctors, Dr. Garcia, works in the chronic pain program. That's an outpatient only setup. So we would really love to grow so we could have at the CHRU an inpatient chronic pain rehabilitation program. So as you can see, I have a lot of ideas. We have a lot of opportunities in front of us.
I think that's incredible. And I know, just speaking from our personal experience, even whenever Nora needed a procedure, we had to be transported by ambulance down the street to the Children's Hospital of Pittsburgh. So if her shunt would malfunction, or if she needed to have any sort of procedure or scan, we actually had to go to the hospital by ambulance. So having the convenience of being on campus, on site at the Children's Hospital, it would just eliminate all of these barriers. And I truly believe that, having the specialists and having the surgeons and doctors and therapists right there, all working hand in hand together, I often share that there were days when Nora, she didn't want to do physical therapy. So we had music therapy get involved, and both of them working in sync, it was some sort of miracle, and she just responded so much better. So having all of these amenities that the Children's Hospital offers, I think will be so beneficial in the long run.
It certainly sounds that way from your own experience, Colby, and from what you've shared, Dr. Houtrow. It seems that also, great benefits to the patients, great benefits to the families, and also great benefits to our providers at the hospital if we could have the inpatient unit on site at the main campus. You shared a lot of fabulous ideas, and you have phenomenal vision stemming from your own life experience. I'm wondering what you think it'll take to get us to that vision, to actually realize that vision, bring that inpatient unit to Children's on campus, and also to try and meet the growing demand that spans Western Pennsylvania.
Well, to reach our potential, I think we need three things. And the really lucky thing is we already have the first. It's a shared vision where all children with disabilities get the care they need to thrive. That children with disabilities in this region and beyond get the care they deserve regardless of their circumstances. So one example, a very clear one, is growing our inpatient comprehensive rehabilitation program, having it be in the main hospital. And that takes resources. So that's the second thing that we need to grow, resources. And that example of bringing the unit to the main hospital includes a whole host of things, like having access to specialized and potentially very expensive equipment, advancing the next frontiers, such as in robotics and virtual reality, to really advance the care that we provide. And then the third thing we need is people. We need the experts that are dedicated, compassionate, and innovative, like you heard on the video today. And I really think that with the vision that we have, with the partnership that we can have with philanthropy, that we'll really be able to achieve these goals and reach our full potential, be a model for the rest of the country, and do right by all children so that they can thrive.
Well, I appreciate that you touched on the role for philanthropy, and I'd love to hear a little bit more about how you think it has an impact, both what you've already seen philanthropy accomplish and how you think that will make a difference moving forward.
Well, we're really very honored to have received some amazing gifts from philanthropists in the region. And for example, we had a very large gift that allows us to buy exceptionally specialized equipment. An example of which, when you saw the video of little 2-year-old Nora walking, that was easy for a therapist to support her body. But just imagine if that was a larger teenager. And we have this very fancy weight supporting system that allows children to have offloading of the weight as they are learning to take steps with their therapists. Without philanthropy, we would not have been able to get that kind of highly specialized equipment. Without philanthropy, the dream of our advanced inpatient rehabilitation unit probably won't be able to come true. And then I also think about how philanthropy can help in moving things forward, advancing the field, giving us the opportunities to innovate. As I talked about before with robotics or virtual reality, those are the next frontiers. In addition, training the members that will provide the care can be an excellent source of support that we get from philanthropy. The field is definitely growing. The number of children who have either temporary or permanent disabilities in the United States and right here in our region is growing. So that means that there's not enough of us around the country. And when we're at a place that provides such excellent quaternary care and can provide rehabilitation services on the continuum, that's an ideal place to train innovatively, We want to be the very, very first fellowship, pediatric rehabilitation medicine fellowship that trains pediatricians. And we need philanthropy partnership to make that happen. We want to be one of the only combined programs that trains medical school graduates to be pediatrician and rehabilitation doctors simultaneously. And we benefit from philanthropy if we want to make that happen. And going back to our vision to help all of the children with disabilities thrive and reach their full potential, we know that philanthropy is an important partner in that.
I appreciate, Amy, what you just shared, and especially pointing to that term partnership, because it is a partnership where philanthropy doesn't have to cover the full cost of these types of investments, but it shares in helping to make that reality possible because of the wonderful resources that UPMC and Children's can dedicate to these resources. But we also know that rehabilitative medicine is one part of a very large UPMC Children's operation with expertise and services that cover a spectrum of illnesses and needs that children have. So we're fortunate that our generous community supports our hospital and programs like yours, and hopefully supporting visions like yours, because our children need the very best care and access to the resources that help them overcome what stands in their way of thriving. I love the way you put that. Colby, when you hear all that Amy has shared with us for the future, what do you feel? How does that make you feel when you think about your experience?
Yeah, I feel hopeful. I truly do. This has been actually a vision of mine that I feel like I shared with your team a long time ago. After Nora went through everything, I always lead with a grateful heart. My husband and I always do. And if you were to ask us, we would say it was enough. But I think the mom in me can't help but wonder, what more could we do? What more could we offer our children? And more importantly, what more could we offer the family? So I feel hopeful. It makes me excited. I think this is an amazing opportunity to bring this on site and to have the rehab unit located at the Children's Hospital of Pittsburgh.
Absolutely. Oh, we're looking at our time and seeing that we should be coming to the end of our program. And I'd love to spend more time talking about our experiences and the possibilities that lay in front of us. And certainly spending time with Dr. Houtrow is always inspirational. She's so passionate in all that she wants to see accomplished for children. But we do need to wrap up our program today. And this is a series, Raising the Bar, with another program planned on Tuesday, May 25th from 9 to 10. We hope you'll tune in. Again, these sessions are recorded and available, and we'll be sending you a link so that you're able to share it. But each of these sessions in the series highlights an area of need and opportunity, and a place where philanthropy is made and will continue to make a big difference. So for all of our guests joining today, thank you for your support of UPMC Children's. We're so grateful for your help in making possible the kind of care and the research that's needed, that's worthy of our children, that they lead and thrive in their lives. Thank you so much for joining us today.